Hello, Dr. Hygiene here. I would like to talk about the sleep disorder and the way to treat the sleep disorders without medication. Interesting enough, usually about problems with sleep, everybody think about taking sleeping pills or antidepressant. It depends with regard to the problem and the issue of how to treat the sleep disorder. At some point, if the reason of the sleep problem is depression and severe anxiety and problems with bipolar or schizophrenia, the medication is being used to treat those underlying conditions and then to deal with the sleep problem. However, in cases that we need to discipline our sleep, is like a little baby that we have to discipline as far as putting the baby in a separate room and not to intervene with the crying and the need of the manipulation of the baby in order to get soothing and attention. We can discipline our brain as far as the sleep cycle. The way it's called with sleep hygiene and disciplining sleep is that in cases that the person has problems with sleep and early awakening and problem falling asleep, one of the ways to deal with it is sleep hygiene. The sleep hygiene is basically the fact of using the bedroom just for sleep, using the bed for sleep and sex. Not to watch TV in bed, not to eat in bed, not to have activities besides sleeping and making love in bed. And the bedroom should be set aside for that kind of reason too. The way to do it is basically to set a time when we go to sleep and set a time that we get up. For example, we go to sleep around 11:30 based on how many hours we need to sleep at night. And going to bed at 11:30, we have to put off the light, not to watch TV. Some people use TV to go to sleep as a sleeping pill, which is not good either. And then try to go to sleep. If we can go to sleep and the sleeping cycle begins, fine. If not, we have to get out of the bed, go to the living room, go outside, sit down, do some boring stuff, a little bit of reading to get a little tired. After we get tired, go back to bed again. Try to go to sleep without watching TV, without having anything introduced in this cycle at night. If it doesn't happen, we continue this cycle until 7 o'clock in the morning. 7 o'clock in the morning, we have to get up. We can still sit and sleep in the bed, even though if you're very tired. Not to take any naps during the day, and then continue this cycle. It's been seen that if we can adhere to this cycle and not introduce any kind of outside stimulants into this cycle, we would have a well-disciplined sleep as a well-disciplined kid. And I hope everybody gets good sleep, and then we'll talk about that later.